Hello, everyone. Thank you for joining us. I'm pretty excited to hear each of our speakers this evening. As we approach the end of the school year, the health and safety of all students, educators, staff, and families continue to be the utmost priority. At PTA, we also remain committed to making sure our students, our families, our schools, and our communities have what they need as the COVID-19 environment evolves. Our goal today is to provide you with important information, resources, and professional expertise to support our families as we move into the summer months. We are so fortunate to have an esteemed group of experts with us today that will address questions and concerns on four things: how parents can navigate the current COVID-19 environment, information and resources on how to partner with teachers and address learning loss, what can parents do to support their child's social, emotional well-being, and how to keep your child safe and healthy this summer. Throughout the conversation, we encourage all of you to post any questions or comments you have in the comments section of this live event. While we are not able to verbally answer them this evening, we will review and respond to them after the event in the comment section as well. So are you ready? Let's get started. I would now like to introduce Erin Billups, who will be moderating this wonderful conversation this evening. Erin has been reporting on health for Spectrum News since 2013. Her coverage regularly highlights public policy responses to health epidemics and widen disparities in access to care. She's the mom of two beautiful young children who are 6 and 7. The pandemic has affected her like it has with every parent across this country. She has published pieces on vaccine hesitancy in the African American community and has a deep interest in how the pandemic has affected our children. Here are a couple of fun facts about Erin that you didn't know. Her favorite color right now is the color green. She trained to be an opera singer. I tried to get her to sing behind the stage and she wouldn't do it. And her mother is a retired teacher. Pretty cool facts, right? Please join me now in welcoming Erin.
Yep. Maybe I need to try and unmute. Zoom rookie mistake there. Anna, thank you so much for that generous introduction. I am honored to serve as your host tonight, and thank you for having me. You know, we really cannot have enough of these conversations about COVID vaccinations, particularly when it comes to children, those we are charged to protect. There is a lot of fear. Tensions can get high. Exploring the lingering concerns and finding mutual understanding is key. There's a lot of misinformation out there that has led to a large number of children who remain unvaccinated. Even with boosters now available to children 5 to 11 years old, just 28%, or about 8 million, can take advantage of that extra layer of protection. About 18.5 million children in that age group have still not been vaccinated. There has been, though, a robust effort to educate those who are on the fence. Our panelists tonight are part of that effort, offering services and resources to families facing barriers to vaccination. We are joined by Dr. Ilan Shaprio, based in the LA area. He is a pediatrician and a spokesperson for the American Academy of Pediatrics. Also taking part in this discussion are two super PTA leaders, Crystal Wesley, PTA president of Adams Elementary in Norman, Oklahoma, and Sandra West, who serves as the directing vice president of the Miami-Dade PTA in Florida. Welcome to our panelists. So let's jump right in. I'd love to start with Crystal. It has been an unprecedented 2+ years for K through 12 students. How was being a parent during this time? How has it informed you, informed how you talk about vaccines with other parents?
I think one of the most amazing things that we get to do as parents and educators alike is to be creative in our approach. So the more education and the more we learn about what's happening, then we're able to inform our children more. So I think our conversations that we have with one another develop as information develops. So something that I find very interesting, or something that's very easy for me to do, is to have conversations that are ongoing, and then also admit whenever we don't know everything. That was, I think, a big part, is admitting that we don't have all the answers right now, but as things develop, we learn more, and making sure that children and families knew that as an educator was really important. Like, I don't know what tomorrow's going to look like. We don't know if we'll have your student in the classroom or if we'll be at home, but we're here to support you guys. We're here to do whatever we can as teachers, and then as a family, making sure my kids understood that as things change, we have to change. So maybe today everybody in the household isn't going or aren't going out, or we aren't doing these things, and then maybe basketball is going to happen tomorrow, So just being real and realistic, and knowing that it was a changing time, and everybody making sure they knew that we were being fluid, allowed for people to respect each other. Because the broken promises, I think, are what hurt most communities, is that people felt like someone just didn't want to help them, or they were doing things in a malicious way, when in actuality, the information was ever changing. And so we were having to change the directions that we were going as information changed. So that was really important, I think, for me as an educator and as a parent.
Yeah, absolutely. And also just being consistent with that message. I'm sure I've heard from a lot of experts that it's really important to keep your data the same, and as it changes, be honest about the fact that it's
honesty was very important. Yes.
So Sandra, in Florida, just given the political climate, a lot fell on the shoulders of the PTA. Can you tell us more about your experience and how you use data to figure out where needs were the greatest? And, Dr. Shapiro, I'm sure you can speak to this, and Crystal as well. Feel free to jump in after Sandra.
Thank you, Erin. And data became really important to us because in a county with 2.7 million people, with over 500,000 of those being under the age of 18, our numbers looked amazing. We were reported in the overall data, we were well over 90% early on. But when we hit over 100%, we knew something was wrong. And in fact, our official numbers report that 106% of our population is vaccinated, which is not technically possible. So one of the concerns we had was that we were getting vaccination reports of people whose addresses are Miami-Dade, but they're not truly in Miami-Dade anymore. So our data was a bit skewed. So one of the things that I did was I dug into the data on the vaccine.gov website to get to a zip code by zip code report, because like I said, there's just no way that was an accurate report to have 106% vaccinated. And in fact, what we found was there were two primary areas that were reported by zip code at less than 80%. So that's where we are concentrating our efforts. We do have countywide clinics going on, and we do have countywide efforts going on, but we wanted to target those zip codes. And by the way, Miami's got 35 zip codes. So a lot of data to look through, and we're hoping to make a difference in those areas.
Yeah, and I'm sure that all of you had to try and get past a lot of barriers that were in the way for the parents that you serve and your patients. Dr. Shapiro, can you talk a little bit about some of the barriers that you were seeing among parents to getting their kids vaccinated? And I absolutely would love to hear Sandra and Crystal chime in on that as well.
Well, I'm going to do full disclosure here. Apart from being a pediatrician, I have another job that is being a father. Then I completely understand every parent that has been around with this. It has been a roller coaster. First, we had the perception that COVID-19 didn't touch our kids. And suddenly after Delta in 2021, we started seeing that kids actually can get harmed. Thanks God, the mortality rate is really low. But what I'm seeing on the clinics and on the hospitals is that we are seeing a lot of kids actually ending up very, very sick there, and also all the multi-inflammatory things that are happening around. Then, of course, one of the things that I saw in my community was, at the beginning, the questions: Is it safe? Is it protecting our kids? Am I doing the right choice? Because I agree with every parent, because I had the same feelings here in my heart, that having to protect our kids is the priority that we have in life. Then how can we do something to harm our kids? But right now, what I was seeing with my patients, the patients that were vaccinated, were actually doing better. We're recovering faster. And most importantly, their families were safer. Then, I started seeing that part, and I worked in LA County and Orange County. Then I was one of those epicenters, apart from New York City, that were part and very, very, we had a lot of harm done to our kids. Then the barriers were about, language, about access, about actually understanding what was the misinformation out there, and not, creating conversations, because some of the times it was just a simple, this is the data, this is what we have, and this is what we know right now. And I vaccinated my kids because I do not want them to stay home, and may God bless all the teachers. I wanted them to actually be safe at school, have the same protection that I actually got, because I got the one, at the beginning of 2021, I got my vaccines then. I wanted to make sure that they were safe, happy, and protected. And the barriers about language, culture, information were important, but most importantly, part of actually having this type of conversation, Erin, like the one that we're having, that we can actually speak freely, give the facts, and after that, families need to decide. But we need to do that process more often.
Yeah, just to piggyback off of what Dr. Shapiro said, I think the three major areas that we looked at was the development, that parents weren't for sure how fast this got developed, like getting it out to kids and making sure that questions were answered, and then that they were answered by qualified people, not just, somebody that heard from my cousin's friend. This was really science vetted questions being answered, and then receiving the appropriate answers. Then the dissemination, making sure that we're getting it to every part of the community. That would be those communities that are wealthy and those that are less wealthy, those that are rural and those that are cities. So making sure that everyone had the same opportunity. Sometimes we talk about our numbers and then we're like, but are they really being served? So it's not that that area maybe doesn't want to receive the vaccination, but there's not one available to them in, let's say, the distance that they can walk. Because we know that a lot of rural areas, especially in Oklahoma, we have a lot of farming areas that weren't having that opportunity. And people were saying, well, they're not, their numbers are much smaller. They don't have transportation, or they may have another situation that doesn't make it available for them to travel 3 hours to the city to receive that. So making sure that we have that dissemination available at all areas. And then just the deployment of that. We know that there was some hesitation at the beginning. There weren't as many places where people could go to get the vaccination. And then some people had misconceptions about whether they had to have insurance to get it, or if they had to pay for it. So making sure, again, that our conversation stayed relevant and factual whenever we shared information about our vaccinations that were being offered, then we would get more feedback. I know a lot of people were like, well, I want Johnson & Johnson, it's only one, or I want this and I want that. So finding out what really helped us get through and be able to help people be informed and make those informed decisions, like Dr. Shapiro said, for their families, is really the hardest hurdle that we faced. I know our school hosted a vaccination clinic, and one thing that we did concentrate on was the language barrier in our community, because a lot of our families had that language barrier and they didn't have maybe readily healthcare. So they didn't have an established doctor that they could pick up the phone and call. So we wanted to bring that to them, and that opportunity to be able to ask a pediatrician and figure out whatever questions they had, and to be able to just to come there and feel safe, because there were school people there that they were recognizing and the kids felt safe, We also embedded in that a store because we know that kids need some kind of incentive at the end of the day when they go to the doctor. So making it a safe place and making it a place where they recognize the people there. So as teachers, we pumped them up as they went in, and our PTA helped by setting up a store so the kids could shop afterwards, and then having our local healthcare authorities there just to answer those questions that we were not, or we felt we were not informed enough. Because, you know, as a teacher, I can tell you what I've heard, but it was much different to hear from the healthcare authorities for our parents. So making that something that we could do.
And Sandra, there were some barriers of to access that you were able to identify. I'd love to hear what some of the solutions were that you found. And also, we did receive some questions in advance from national PTA members, and this one is related. What have been some of the most effective outreach efforts or events done to help encourage families to learn more about the vaccine and perhaps change their mind in vaccinating their children? We heard a little bit from Crystal about that. Would love to hear more from your experience, Sandra.
Well, just like Crystal mentioned, access is an issue even in a big city, because not everybody has access to vehicles, and many of our COVID vaccination sites were drive-through. And that, you know, it's great that Uber and Lyft are providing free transportation to COVID vaccination sites, but they're not going to drive you through a COVID vaccination site. And in fact, when we set up our COVID vaccination site at one of our local parks, there was an existing vaccination site there, but it was drive-through only. And so we set up in a section just on the other side to take walk-ups. And in fact, we went over and informed the other clinic to send anyone who walked up our way, so that we were covering all those who wanted to get vaccinations. The other problem we have is there's a hesitancy to sign up if you are undocumented. So I mentioned earlier that we have 106% vaccination. Some of those 106% may be undocumented individuals who are not part of the last census, because they are hesitant to put their name down on anything official, just in general. We see that with a lot of our migrant populations, especially down in our agricultural areas.
And I have another question for Dr. Shapiro from a national PTA member that was submitted in advance. What are the best ways for parents to ensure their kids stay safe and healthy this summer and into the fall?
First of all, we need to recognize a couple of things. If we're with a lot of people in a closed space with poor ventilation, we're getting closer to not just COVID-19, but other viruses. We can consider using a mask. The other thing is, if we're doing, activities, try to plan it to do them in open space. Go to the park. Go to a lot of things that are amazing. Yes, it's going to be warm, but that's beautiful because we have been sheltered inside of our houses, and we can go out, and it's actually safer for all of us. The other thing that we need to consider for sure is right now that we felt for the past months that COVID gave us like a little vacation, but it hasn't gone away. It's still with us. Then in order for our kids, and probably sadly, if it repeats the same cycles that we saw in 2020 and 21, we probably will see a peak in fall and winter. Then it's a good time to consider getting their vaccines ready, making sure if they're eligible to getting the booster shot, to start having those conversations and gather information to form an informed, decision for them and for their kids. And very importantly, we need to talk about this. We need to talk about wellness. We need to start moving more, making sure that we're eating better, making sure that our mental health state, our heart, and our community are healthy, because those things actually make a huge difference if you get COVID or not. If you get it, maybe you will get it and you have the same risk, but the possibility of actually getting complications and other things, if you're healthy, eating well, and taking care of yourself in your heart and your body, that actually will give you a better chance for you and your kids to actually have a healthier life. Then those are a couple of things that they can do in summer.
Yeah, wonderful. we are coming to the end of this panel discussion. I know the time went really fast, but I wanted to end with another question to you, Dr. Shapiro, especially as we're looking at cases continuing to rise right now. There is this persistent misinformation about vaccine safety. And a lot of it is wrapped in a sense of fear of the unknown. And so as we're looking forward to the next school year and potentially, I'm sure some of the PTAs and schools would like to see more students vaccinated, how can people try to counteract that fear, that misinformation? What is some advice you can lend to parents?
The first thing, Erin, that we need to acknowledge that fear is real and it's okay to have questions. I prefer my parents to actually come and my family members to come to me with a lot of questions and not just accept the status quo. Right now, thanks God, we actually have really good sources of information for the millions of kids that we have vaccinated, and more than half of humanity has been vaccinated at least with one vaccine. Then we know that the vaccine is making a difference. And the vaccine that we have here in the US, at least we have 3 choices. Other countries don't have not even one. Then at least we're moving forward and we have things in front of us. The third thing that we need to understand is that the COVID-19 does not speak human and has not gone to law school. Then, it's still there and it hasn't gone on vacation. Then we need to make sure that whatever decisions we're making, we need to account for that the virus is still here. We'll probably have more variants, and that's true. The virus actually will start replicating more, will be more infecting more people. But right now, the important thing is, what are we going to do? First of all, we need to make sure that whenever we get a WhatsApp, Instagram, Facebook, or anything that it looks like weird, the source of information, it's not clear. And at the end of the day, the plus is when they try to sell you some type of product at the end of the conversation, then make sure that you don't send it to anybody else. Just delete it, cancel it, destroy it. Just leave it as it is. Because one of the things that we have seen already, and probably Dr. Webb actually can talk a little bit more about this, is that when we can be part of the other pandemic, the misinformation pandemic, then at the moment that we actually can start creating, we need always to have conversations, but when it's kind of sketchy, don't do it.
Great advice. Thank you so much to our panelists, Dr. Shapiro, Sandra West, Crystal Wesley. We really appreciate you sharing your experiences.
Thank you, Erin.
You're welcome. So it's time now to move to our next panel, how research and science can inform parent and caregiver decision-making. The Kaiser Family Foundation Vaccine Monitor has been keeping tabs on public sentiment surrounding vaccines since they've become available. And in one of its recent polls, they found that 56% of parents of children under 5 say they don't have enough information about COVID vaccine safety. There is, however, more confidence in vaccines among parents of older children. In this next panel, the experts joining us hope to help parents navigate the overwhelming amount of good and bad information out there by pointing to the research and science that is available to us. Please welcome Dr. Greta Massetti. She is the Principal Deputy Incident Manager for the CDC's COVID-19 response team. And we also welcome White House Senior Policy Advisor, Dr. Cameron Webb. But first, we open the floor to Dr. Massetti.
Good evening, and thank you all for inviting me to be here today. First and foremost, I want to applaud our parents, educators, and children. The past 2 years have certainly not been easy, but our parents, educators, and children have met new challenges and shown remarkable innovation and resilience. I commend each of you for the hardships that you have endured and overcome. The strength that you have displayed as you've navigated adversity is inspiring. As a parent myself, and in my role on CDC's COVID-19 response to advise and develop guidance for communities and schools, the health and safety of our children, teachers, and parents has often been at the forefront of my mind. I look forward to discussing the ways that research and science have critically informed our guidance and recommendations to keep everyone in our school environment safe and healthy, as well as the leading role vaccines play in our public health strategy. While children have a lower risk for severe COVID-19 compared to adults, children can get COVID-19, spread it to others, and become seriously ill. Since the pandemic began, more than 4.3 million COVID-19 infections have been reported among children ages 5 through 11 years, and thousands have been hospitalized. Nonetheless, children who are infected with the virus that causes COVID-19 are more likely than adults to have mild illness. CDC has been committed to using data and our best science to provide recommendations to parents and educators about the best ways to ensure safe, supportive learning environments for students. Over the past 2 years, we have learned a lot about ways to protect in-person learning by hearing directly from educators and parents about what was working well in local communities. Staying up to date with COVID-19 vaccinations is the leading public health strategy we have to prevent severe disease for both children and adults. I know many parents will have questions. What are the risks of COVID-19 to my child? Should I vaccinate my own child? I want to be clear in speaking to these questions. CDC recommends every child over the age of 5 get vaccinated against COVID-19. The COVID-19 vaccines have and continue to undergo the most comprehensive and intense safety monitoring program in US history. The most common reported side effects among 5 to 11-year-olds after vaccination have been mild and include sore arm, headache, and fatigue. Tens of millions of children and adolescents, ages 5 through 17 years, have received at least one dose of the COVID-19 vaccine, and the known benefits of COVID-19 vaccination in children and adolescents outweigh the known and potential risks. Vaccination rates among children and adolescents are substantially lower than any other eligible age group, leaving our youth vulnerable to the potential severe outcomes of infection. Currently, only 28.9% of 5 to 11-year-olds in the United States are fully vaccinated against COVID-19, while 59.3% of those ages 12 to 17 years are fully vaccinated. Only 25.3% have received a booster dose. COVID-19 vaccines for children, together with our scientifically supported layered prevention measures, have the potential to protect more than just our children's physical health by allowing and ensuring children can learn in safe and healthy environments. We have seen the ways that this pandemic has threatened the social and emotional well-being of children. For many children, school is a safe and enriching environment. For the past 2 years, many children have felt the effects of school closures, outbreaks among students and school staff, and ultimately changes in their normal school environment due to COVID-19. Our goal and priority at CDC has been to get children back to in-person learning. Right now, over 99% of students and over 99% of school districts are in the classroom in person. This is a huge success. CDC has issued COVID-19 guidance for schools that allows students to stay in school for safe in-person learning. Through this guidance, though this guidance is written for COVID-19 prevention, many of our layered prevention strategies outlined in the guidance can help prevent and mitigate the spread of other infectious diseases like the flu and RSV. With our layered prevention strategies in place and with vaccines available together, we can help protect our children and keep them in school. With that, I look forward to our discussion this evening.
Thank you, Dr. Massetti. We'd love to have a few words now from Dr. Webb.
Absolutely. Well, it's great to be with you all this evening. And Dr. Massetti really just laid out so many of the really critical facts, the information that helps inform not just the state of the pandemic with regard to kids, but also the data, the science behind the vaccines themselves. And I think it's really important that I take a step back and talk to you, yes, as a senior policy advisor on the White House COVID response team, but also as a parent. And I'm a parent with 2 kids in the age range of 5 to 11. My son, who's 7 years old now, started kindergarten virtually. And that was really difficult for him. Imagine trying to log on to Zoom for your first day of kindergarten. And for my daughter, who's now 10 years old, she missed what was going to be her first season of competitive basketball, which was really heartbreaking for her. And I think about those experiences. I think about those challenges that my kids had, but also so many other challenges that kids are facing. And so when you fast forward to the availability of the vaccines for kids, and talking specifically about kids 5 to 11 right now, I put myself in that position as a parent, making the decision about vaccinating my kids. And so, our prompt here is how research and science can inform parent and caregiver decision-making, but I remember how I approached that. And so I just want to share with you, as a parent, first and foremost, my goal is to keep my kids as safe as possible. The first thing I had to do was really orient myself to what are facts, what's true information versus what's misinformation or disinformation. Really quickly, I had to go to what do we know about these vaccines and how do they work? Are they safe in kids and are they effective? And if you looked back at those original trials, which is actually how I helped, my wife and I helped make that decision, we looked at the data and it showed that there were no severe adverse events in kids receiving the COVID vaccine in that 5 to 11-year-old age range, which was really important for us to hear and see that it was truly a safe vaccine. The next question is, well, does it work? And seeing the clear difference in protection, because even though it's rare the kids become really sick with COVID-19, we wanted to, as much as possible, prevent that likelihood. And again, the science and the data told us that it also would help keep our kids a little bit safer. When you put those two things together, we were able to harness the information and the science and apply that to the decision that we had to make late last fall. And we got both of our kids vaccinated. They were vaccinated, they got their 2 shots, and hopefully soon they're going to get their boosters as well. I know the FDA is discussing that. There's a meeting tomorrow of CDC to discuss it. And so I walk you through that process because, sure, there are all kinds of people who have all kinds of information. It comes from all corners of the internet. And what you really have to do, first and foremost, is understand what's good information, what's real and true information, and what's false. I will say, kind of at the top, one of my favorite websites is www.cdc.gov, and you can say /COVID. And on there, you can go for children. And when you click on that subpage, it's got all the information about vaccines for children, about COVID and its impact on children. And it is one of the most comprehensive and thorough spaces for information, data, and science about this pandemic for kids. So we're all going to be weighing risks and benefits, but we know we have safe and effective vaccines. We know we have a virus that can cause some harm. And I want to be clear, I don't want to overstate how kids are less likely to have severe outcomes from COVID, because kids with special healthcare needs, with genetic, neurologic, or metabolic conditions or congenital heart disease, they can have increased risk for severe illness from COVID-19. Kids with obesity, diabetes, asthma, chronic lung disease, sickle cell disease, or immunosuppression, they can have increased risk for severe COVID-19. And so we don't lose sight of that. Those are my children's classmates, their friends, people who are around. It's all of our responsibility to keep them safe using all the tools that we have, not just vaccines, but including vaccines. And having traveled the country talking to community members and leaders and parents and students about COVID, I've answered questions about whether or not masks actually work. And spoiler alert, they do. They can be really an effective way at helping to prevent illness. As we move into moments like the one we're in right now, where we're seeing an uptick in cases in parts all around the country, where now about 1/3 of our counties across the country are in that range of medium to high COVID community levels. And folks should think about whether or not masking would be helpful in those circumstances. What I say is, use all the information available to you. Take full advantage of that. Make decisions that are going to help keep you, your family, and your community as safe as possible, in particular, those little ones. So I'm excited for the conversation today, both as a parent, but also as a policy advisor. And really, thanks for having me this evening.
Thank you so much for that, Dr. Webb. That was so helpful. I think, especially as we're seeing cases climb, it would be really important to talk about and really give people a sense of the numbers of the difference that the vaccines have made in the population of kids who actually got vaccinated, particularly during the height of the January Omicron surge. Dr. Massetti, can you speak to that a little bit as well? And of course, Dr. Webb, feel free to chime in.
I think that there's probably a lot of parents who have questions about the protection that vaccines provide, and also, what protection children might have if they've been infected with SARS-CoV-2, which is the virus that causes COVID-19. So I just want to underscore what Dr. Webb just mentioned because it's such an important message. The vaccines are safe and effective, and they are really the safest strategy to protect people, to give people protection, including children and adults, against severe disease from COVID-19. One thing that we've been talking a lot about is this concept of layered immunity, right? That there's some people who might have some protection from prior infection, and some people have protection from vaccines, and some people might have boosters. But really, the best way to be sure that a child has the safest pathway towards immunity and towards being protected against severe disease is to stay up to date with vaccination and ensure that all children are vaccinated. And that's a way to protect them and their family members as well.
Yeah, I just want to throw out a little bit more data, and I definitely appreciate what Dr. Massetti was saying, but I think about some more numbers. There were some studies looking at what's called seroprevalence, how many people have had COVID-19. And when they look specifically at kids, so under 18, their estimate was that as many as 3/4 of kids have had COVID-19. But that doesn't mean that all of those kids have everlasting natural immunity. It's really important to really calibrate people's sense of the value of natural immunity and the value of vaccines, because in both cases, that protection wanes over time. It's the reason why FDA this week is talking about boosters for kids with vaccines, but it's also the reason why kids who've had COVID before can have COVID again. And I don't want to make this, too framed around my perspective, but to be clear, if my kids have to miss several days of school, that doesn't make me happy. Even if they're not severely ill from COVID-19, it's disruptive. For me, it's disruptive for our family. It's disruptive for a lot of things. Imagine having to do that again just a couple months later, right? And so some of the best ways to protect ourselves, yes, is making sure your kid is vaccinated, but also, as Dr. Massetti is saying, these layered mitigation strategies, you've probably heard that term over and over again. That layering of strategies continues to be important. And in our state, I'm in the Commonwealth of Virginia. Here, it's not required that kids wear masks in schools anymore, but my kids continue to do so. It's one of our ways of minimizing the disruption, the potential disruption of a COVID infection on our family. So that's something to think about and to keep in mind. And when you couple that with their vaccinated status and hopefully their soon to be boosted status, we're really trying to layer our ability to keep them home. And one thing we haven't talked enough about here is the value of testing in kids, because my kids, just like probably your kids as well, do come home with a cold or a runny nose or a stuffy nose every now and then. And we have COVID tests available and ready so that we can test them at any given time and know what it is that we're dealing with. And, we can get a sense from those rapid tests here at home. In fact, this week, the administration just announced we're sending 8 more free tests to every home. So you can log on to covidtest.gov and request 8 more tests. They'll arrive at your house within the next week. But I think that kind of thing is another part of the mitigation strategy. Knowing whether or not you have COVID can help keep other people in the family and in the community safe. And so when we look back at January, in that incredible surge in cases from Omicron, what I can say is the fact that we had kids vaccinated from COVID-19 just a couple months earlier absolutely reduced the overall burden of COVID-19 in that community. I would say it probably helped keep some schools open where that could have been harder if you saw that many more cases. And certainly helped prevent some hospitalizations and deaths among kids. Even though they're rare, it's phenomenal that we were able to save those lives. We're excited to do the same thing for kids under 5 as soon as that becomes available. I think that we have to continue to look to vaccines as a key part of keeping our community safe.
Yeah, I wanted to stay a little bit on the issue of testing. And you are absolutely right, Dr. Webb. Both of my children are also vaccinated. And just recently, 2 weeks ago, they both tested positive with COVID, and I had to stay home with them, which was a huge disruption because they were totally fine by every measure that I could tell. And I'm grateful because I do think they had that extra layer of protection. Now, fewer Americans are actually going in for PCR tests. More are testing at home, which is what the CDC and the White House wants to see. But it makes it a bit hard to get a clearer picture of transmission trends. What does the CDC, the White House want to see in terms of testing, particularly for return to work and school policies during surges like the one we're in now and for those in the future?
Well, and I can start, but I know Dr. Massetti will have something to add there. The first, I would say, I still am a little bit short of calling where we are currently a surge. I know we have some increases in cases in different places, but having been through a couple of surges, I don't think we're quite there definitionally yet. But what I will say is there's a heightened awareness that there's a lot of COVID out there. We know that this variant is moving fast, and I think people should have that high level of vigilance right now because we're seeing some increases. I think that when it comes to testing, I want to be unequivocal about this. At-home testing is a good thing. The fact that tests are available, the fact that I can look across the room and I see 2 tests stacked up on the counter over there, the fact that there are tests for my kids, both from the federal government, from private insurance, where you can get 8 tests per month per covered individual, using all of those free tests and make sure that's part of staying safe. That's huge. And I understand the trade-off is not knowing the exact number of cases, but the benefit is fewer people with COVID then are going to be out in the community impacting other folks. The key here, though, is that the COVID community levels, which I'm sure Dr. Massetti will talk about some, it's a really elegant way of bridging both COVID cases where we're never going to know the exact number, but also COVID's impact on disrupting our community by really tracking, yes, cases, but also specifically hospitalizations in our hospital capacity. We're able to really get a sense of what is COVID doing to our community at this point in time and how worried should we be. And I want to be clear for a lot of folks who ask about whether or not we're still keeping track. Have we given up the ghost, as they often say, on trying to prevent COVID cases? Absolutely not. We're still very committed because there are some people for whom a COVID case can be devastating. We still have about 300 people per day over the last 7 days who are dying from COVID. So if we can prevent a case, that is a very good thing. The key here is knowing that we're also tracking, the amount of transmission through wastewater testing. We're tracking it through symptom surveys. We're tracking it through Google search trends. We're working closely with states to see what information they have. So there are lots of ways that we can get that leading indicator of cases rising before we see the hospitalizations rising and sadly the deaths. We put all that information together so that we can inform communities on the front end and say, hey, there's a little bit more risk coming your way. You can go to cdc.gov or you can go to covid.gov. And at the top of that page, you can type in your county. I did it just tonight. You can type in your county, and every Thursday afternoon that's updated, and it'll tell you your COVID community level, if it's low, medium, or high. Really important in informing what you do over the next week. But Dr. Massetti, not sure if you had anything you wanted to add.
Great. Thank you so much, Dr. Webb. I agree with all of your comments. A couple of points that I wanted to underscore. One related to testing is that putting tests in the hands of families means that they have quick access to information so that they can make the best decisions for themselves, right? They don't have to worry about, if my child has the sniffles, do I have to find a place where there's a test? Do I need to make an appointment or not make an appointment? They can very quickly pull out that test, get information, make a decision about whether they need to keep them home from school, whether they might have been exposed, or who else might have been exposed. And it just really allows the power in the hands of families. Dr. Webb also mentioned our COVID-19 community levels, which is the framework that CDC uses to monitor information and data at the county level and use that framework to provide recommendations to individuals and to local officials about kind of what prevention measures to take. And as Dr. Webb mentioned, one component of that is the number of new cases in the community. And also we layer in information about new hospitalizations and what proportion of the inpatients have COVID-19 in the local hospitals. That gives you key information about not only how much disease is there in the community, but is that disease severe enough to cause people to have to seek medical care. And as we're seeing milder disease, both because of milder variants and also because people have some layers of protection from prior infection and from vaccination, it's really key to be able to understand what is the impact on local communities of the disease currently. Is it severe? Are we seeing hospitalizations increase? And though we may be missing some cases, we are seeing a very gentle rise in hospitalizations that is less less severe than we have seen in prior surges, and we have not yet seen an increase in deaths. We're still continuing to see declines in deaths. So that suggests that we are continuing to do a good job of protecting communities. But that's a key, that COVID-19 community levels is a key piece of information that we really encourage schools, educators, families to keep an eye on so that they can make decisions for themselves based on kind of their own level of risk, their risk tolerance, and what's happening in their community.
You know, Dr. Webb mentioned that hopefully vaccines will soon be available for children under the age of 5. I know a lot of parents that are chomping at the bit, but also, as I mentioned, as we started this panel, there's quite a few parents of children under the age of 5 who are concerned. Now, I know the process is still ongoing. The FDA and the CDC need to make a decision on whether to make those vaccines available to the youngest kids. But I've been hearing from parents who have children who are vaccinated, who then just, heard, oh, I can get a booster for my 5-year-old, but my 4-year-old is still left unprotected. So there's a lot of frustration there. And then there are a lot of other parents who simply aren't interested in vaccinating their youngest children. So throwing to a question again from one of our national PTA members who's asking, how are you working to make vaccine information more digestible for those concerned parents? And yes, go right ahead, Dr. Massetti.
That's a great question, because ultimately the most important way to empower families to make the best decisions for their families is to give them the information they need. And so we're doing that in a number of ways. One is by putting information out there through social media, through our website, through materials that is digestible and easily accessed information about the vaccines, their safety, their efficacy, how many people are vaccinated. We also, it is one key piece as well is to partner with trusted organizations. The American Academy of Pediatrics is a perfect example of that. A lot of families trust their pediatrician. They have built a relationship over time with them. They've known their children since they were babies. And oftentimes those are the key trusted voices that families rely on. So we make sure that we're working with the American Academy of Pediatrics, other provider groups, education groups like the National PTA, and others, so that we are giving everybody the information they need to help talk to each other and make those key connections to provide families the information they need to make decisions.
Yeah, and Dr. Webb, some might say good ventilation in schools is second only to vaccination when it comes to some of the most effective prevention tools. Over the past couple of years, a lot of work has been done to get school buildings up to recommended standards. But once again, there are schools that have been left behind in this area. So just wondering if you could walk through what's being done to make sure there is proper ventilation in every classroom in the country.
Well, Dr. Massetti may be able to add even more detail on this, but what I will say is that when we released the National Pandemic Preparedness Plan, I know we've released several plans from the White House over the course of the last year and a half, but when we released the most recent plan, the Pandemic Preparedness Plan, we also talked about how critically important ventilation was going to continue to be. We know that that's something that we have the resources from the American Rescue Plan to make sure that schools have access, but by the beginning of this year is really apparent not all schools had been able to access, harness, and make the recommended updates and upgrades. And so for that reason, we started working really hard to kind of between industry, with schools, across government, to make it easier and just increase the likelihood that schools were going to be taking advantage of that. And so that's continues to be underway. We've seen a lot of progress in the time since then. And I agree with you, ventilation is critically important. My mom is a teacher. Ventilation was one of the first things that she was saying she wanted to make sure was available in her school so that she felt safe. Certainly don't want to leave masks out of the conversation because they continue to be an important one that's widely accessible for folks. But when you put those layers together, again, can do a lot of good. But Dr. Massetti, not sure if you wanted to add anything. I know you've done a ton of work in the schools yourself.
Great. Yes, thank you so much, Dr. Webb. I think that there's those two pieces, right? So one is what Dr. Webb just mentioned about making resources available to schools to make those critical infrastructure improvements. And some of them can be quite expensive, others are not. The other component is to make information available to educators so that they know what it means, right? In the last 2 years, we've learned so much about COVID-19, about respiratory viruses, and we've learned a lot about ventilation. But I think that's one of the first questions that we all asked ourselves is, what does it mean to improve ventilation? How do you do it? What are some of the ways that are effective? What are the costs? And so I think that's a key piece, is to ensure that we're reaching schools with information about how to effectively improve ventilation. And that's, through both our science, but also our messaging, our tools. We have an interactive tool on our website where you can actually kind of do some modifications to a space to see what happens if you open the windows, if you change the filters. And that way we know we can help educators make decisions about what their space looks like and how to make air quality improvements so that we improve ventilation in those spaces.
And just to add really quickly, I'll just say, certainly so many folks are taking advantage of having HEPA filters or even, building the Corsi Rosenthal boxes, right, to improve filtration. There's a lot of information out there for how people can optimize that, but that doesn't obviate the need of local, state, and federal government to really support folks in having the best environment possible. There's a lot of science that tells us that filtration is going to be really important in that space. And so, certainly as parents, as families, as communities, asking those questions of how things are looking, locally, and continuing to let folks know those resources are there, they are available. We want to support and assist as much as possible.
Yeah, thank you to both of you for that response on ventilation. I think it may not be directly health related, but some will argue that it is. But wondering if you guys can walk us through what sort of plans or preparation are in place to address the learning loss that has happened over the last 2 years. Any sort of more collaborative approach that the CDC and the White House might be taking to address not only those disparities in education that came or were widened as a result of the pandemic, but also to address the mental health needs of children who are also, and even their teachers who are reeling from an unprecedented 2 years. Either of you could jump in on that one.
So I might just start with talking a little bit about kind of the mental health work and the importance of mental health and mental wellness in schools. We've seen a number of scientific articles as well as pieces in the news media about the mental health crisis right now that we're experiencing among children and adolescents. And so I think that the important thing to acknowledge is that we really need to have awareness that there's a problem and that mental health can be a barrier to education. It can be a barrier to learning. And so ensuring that families are supported, that educators have the resources they need to identify mental health issues, and that to address them through kind of the trauma-informed educational approaches. CDC has a number of programs and activities working with schools, with local and state education to provide supports, technical assistance, resources so that educators are supported in addressing mental health issues in school settings. We also work very closely with our federal partners, including the Department of Education, to really understand kind of the intersection between mental health, education, physical health and wellness, so that we're really understanding that schools are environments where people have the opportunity to learn in safe and supportive contexts, and that we really need to address all of those components: mental health, physical health, learning, that those things are not independent, but they're interrelated. And that's really the critical approach that we need.
Yeah, and I'll just add that, just the other month, there was a statement released from the White House and the Department of Education. Secretary Cardona there has talked a lot about how important it is that we continue to invest in addressing learning loss. And I know there were over $120 billion that have been going to so-called ESSER funds, the emergency relief funds from the American Rescue Plan, that are so important so that school districts have additional resources to address those challenges. And even with an additional $8 billion that went specifically to special populations and some of those needs. And so, we don't want to just throw money at the problems. So the Department of Education is also providing a lot of technical assistance on that front. But to be clear, we know this is going to take a lot of work and it's going to take some time. We all know even before COVID-19, that notion of summer slide for students in some communities, and you compound that with what people experienced through the pandemic, we have our work cut out to catch up. But again, we're equal to the task. And I just want to say a quick word about the mental health piece, because, it's not lost on me the number of children. When we talk about 1 million deaths from COVID, the number of children who lost a primary caregiver, the number of children who were orphaned through this pandemic, the number of children who lost a loving grandparent, that is a tragedy of really an immeasurable scale. And I think that's something for us to always keep in mind and to think about the impact that's having on students, on communities at any given time. And so even though this is a conversation about kids and about vaccines and masks and ventilation, I want to make sure to lift up some of the ways that we can prevent additional kids from losing a caregiver, from being orphaned, from losing a loving, caring grandparent. One of the things they can do is take advantage of some of the new tools that we have. So for adults who do get COVID-19 at this phase, we have widely available these new oral antiviral pills. One is called Paxlovid, and they can reduce the likelihood of hospitalization or death for folks over the age of 12. They can reduce that likelihood by 90%. And so it's so important that people know that exists, that this medication is available, that you can get a prescription. You have to take it within 5 days of the start of your symptoms. But if you do, it can really significantly reduce the risk of hospitalization or death. And so again, that's one of our ways of caring for our young people, is by keeping their parents, their grandparents out of the hospital, making sure that's not something they're worried about while they're trying to learn. I think that's something that's really important to lift up.
Yeah, we certainly have a whole kit of tools now that we didn't have even just a year ago. So really great information. Thank you so much, Dr. Massetti, Dr. Webb. We really appreciate your insights. That concludes this panel. I wanted to thank everyone from the earlier panel to, our federal officials who joined us tonight. Thank you so much for sharing your expertise, your experiences with us. Thank you also to the National PTA for creating this space for discussion. This town hall will be available on the NPTA's Facebook page. So if you have friends who couldn't make it tonight, but would love to listen and learn as well, they can do that whenever it's most convenient for them. And I'd also like to thank NPTA President Anna King. Thank you so much for holding this event. The floor is yours.
Well, thank you, Miss Erin. You are amazing. You're a wonderful moderator for this evening and this discussion and this conversation. Thank you. Thank you for being here with us. Dr. Webb, Dr. Massetti, Dr. Shapiro, Sandra, and Crystal, thank you all for all of your insight, your advice, your resources that you guys have shared with everyone this evening. This was a really good discussion, and it was full of important information for our families and communities. And I hope that everybody listening heard what they were saying. This is important. This is affecting our children. And to everyone watching, all of you, thank you for joining us and listening to this conversation. Please continue to follow National PTA, CDC, the Department of Health and Human Services, and the American Academy of Pediatrics for more information and resources, not only to support you for the remainder of the school year, but into the summer as well. National PTA will be continuing this important conversation during a symposium at our 125th anniversary convention, which will be held June 14th through the 19th at the Gaylord National Resort and Convention Center at the National Harbor, Maryland, in Maryland. We hope that you guys will join us there too. It's going to be a great conversation as well. Before I go, I want to say thank you, Dr. Massetti and Dr. Webb, for mentioning mental health. Tomorrow, if you didn't know, May 19th has been designated as the Mental Health Action Day as part of the Mental Health Awareness Month. Mental health is one of the most pressing issues to address because of the COVID-19 pandemic. We hope that you will join us in supporting Mental Health Day, and we encourage you to visit pta.org/healthymind for resources to support our families in prioritizing a proactive and holistic approach to mental health. We wish everyone a safe and healthy end of the school year. Thank you again for joining us, this wonderful group with this great information. Be safe and have a good night, everyone. Bye.